Avodart is a medication used in men to treat the symptoms of an enlarged prostate, also known as benign prostatic hyperplasia, BPH. It works by reducing the size of the enlarged prostate, which helps to relieve symptoms such as difficulty in beginning the flow of urine, weak stream, and the need to urinate often or urgently, including during the middle of the night. It may also reduce the need for surgery to treat BPH. However, it is important to note that Avodart is not approved for the prevention of prostate cancer and may slightly increase the risk of developing a very serious form of prostate cancer. It is important to talk to your doctor about the benefits and risks of taking Avodart. Additionally, it's important to note that this medication should not be used by women or children. As for the daily dosage and optimal timing, it's best to follow your doctor's instructions and take Avodart as prescribed. Before you start taking Avodart, make sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Swallow the medication whole. Do not crush or chew the capsules. Using Avodart regularly will help you get the most benefit from it. To help you remember, take it at the same time each day. It's important to note that women who are pregnant or may become pregnant should not handle this medication, as it can be absorbed through the skin and may harm an unborn baby. It may take 3 to 6 months to notice an improvement in symptoms. If your symptoms do not improve or worsen, make sure to inform your doctor. Some side effects of Avodart may include sexual problems, testicle pain/swelling, increased breast size, or breast tenderness. These sexual problems have continued in some men even after stopping treatment. If any of these effects last or get worse, tell your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. A very serious allergic reaction to this drug is rare. However, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or you may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or you may report side effects to Health Canada at 1-866-234-2345. Before starting dutasteride, make sure to inform your doctor or pharmacist if you have any allergies to this medication or similar ones. Also, let them know about your medical history and any other medications or herbal products you may be using. It's important to mention this to your doctor or dentist before any surgeries as well. If you are taking dutasteride, it's important not to donate blood and to wait at least 6 months after stopping the medication before doing so, to avoid the risk of pregnant women receiving your blood. It's crucial to note that this medication should not be used by women, especially during pregnancy or while breastfeeding, as it may harm an unborn or breastfeeding baby. Always consult with your doctor for more information on this. It's important to be aware of potential drug interactions with Avodart. These interactions can affect how Avodart works or increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you are using, and share it with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medications without consulting your doctor. This will help ensure the safe and effective use of Avodart. If someone has taken too much Avodart and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the US, you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. It's important not to share Avodart with others. Your doctor may also recommend lab and/or medical tests, such as prostate exams and prostate-specific antigen PSA tests, while you are taking this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Avodart, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. When storing Avodart, make sure to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. Dutasteride capsules can soften and leak if exposed to high temperatures. If you notice any cracked or leaking capsules, do not use them. If the leaking substance comes into contact with your skin, wash the area immediately with soap and water. For more information, contact your pharmacist. Do not flush Avodart down the toilet or pour it into a drain unless specifically instructed to do so. When the medication is expired or no longer needed, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.